All right, everyone get ready because today we are going deep into the world of prostate cancer.
Oh, yeah.
Specifically, we're looking at the brand new 224 European Association of Urology guidelines.
The EAU guidelines.
And you've given me a ton of material here,
Yeah.
but don't worry, listeners.
What?
We have pulled out the absolute need-to-know info just for you guys.
Absolutely.
So,
These guidelines are a pretty big deal.
okay.
They're internationally endorsed, and they involve some really big names in the field, like
Okay.
the European Association of Nuclear Medicine, the EANM,
Wow.
the European Society for Radiotherapy and Oncology,
All right.
ESTRO, and even the International Society of Urological Pathology.
The ISP?
The ISUP.
So it's not just like,
It's not just a European thing.
yeah.
These guidelines impact how doctors all over the world are thinking about prostate cancer.
So it's like the Avengers assembled for prostate cancer.
Exactly. That's awesome. And they really did take their job seriously. Combing through just thousands of publications from just the past 2 years.
Wow.
We're talking about a very structured, evidence-based approach.
Okay.
They consider not just the science,
Yeah.
but also patient preferences when making these recommendations.
So they're actually taking into account what patients want.
Absolutely.
That's really good.
But remember, even with all this rigorous methodology, science is constantly evolving.
Oh, for sure.
What we're talking about today is the current consensus.
Right.
But it's an ongoing conversation.
Always learning. That's why these updates are so important.
Right.
So let's get down to it. Why is early detection of prostate cancer so crucial?
Yeah.
Is it really a life or death situation?
Well, let's think about it this way. The prostate is a small gland found only in men.
Okay.
It sits right below the bladder, and it plays a role in producing semen.
Gotcha.
Prostate cancer happens when the cells in the prostate start multiplying out of control when it's caught early. While it's still confined to the prostate,
Okay.
treatment is much more effective.
Right.
And the survival rates absolutely skyrocket.
So the earlier you catch it, the better your odds are going to be.
That's exactly right.
That makes sense.
Yeah.
But there's been so much debate around the PSA test.
Right.
Is it a reliable way to spot prostate cancer?
Well, the PSA test, which stands for prostate-specific antigen,
Right.
it measures a protein that's produced by the prostate.
Okay.
Elevated levels can indicate cancer.
Yeah.
But here's the thing.
What's the thing?
It's not foolproof.
Okay.
Things like BPH,
Yeah.
benign prostatic hyperplasia, or even inflammation can cause PSA to spike.
So it's not just a simple high PSA equals cancer.
Not necessarily, no.
Okay. And I know that's where those risk calculators come in.
Exactly.
Trying to kind of like
Add some nuance.
add some nuance, to the number.
Exactly.
Okay.
Factors like age, family history, ethnicity,
Wow.
and of course PSA levels are all fed into these calculators to give a more personalized risk assessment.
That makes sense.
And you know what I think is fascinating?
What?
A large European study, the ERSPC,
ERSPC.
they found that the number of men we need to screen to prevent one death from prostate cancer
Wow.
is now on par with breast cancer screening trials.
That's a huge deal.
It's a big deal
Yeah.
in terms of how we think about PSA screening.
Right. So
Yeah.
the impact of screening is becoming more clear. It's
No.
not just throwing darts in the dark anymore.
Exactly.
But besides PSA and those,
Uncomfortable.
those awkward digital rectal exams,
Yeah.
what other tools are doctors using for early detection these days?
Well, genetic testing is becoming increasingly important.
Okay.
We can look for inherited mutations, what's called germline testing,
Right.
or analyze the tumor itself with somatic testing.
Okay.
And a recent study found that over 17% of prostate cancer patients had a pathogenic germline mutation,
Wow.
meaning they were predisposed to the disease.
So for some men, it's not just bad luck. It's like in their genes.
There's a genetic component at play.
That's huge for understanding risk.
It is.
Yeah, but how do we move from suspicion of prostate cancer to actual diagnosis?
Yeah.
I imagine it involves more than just
Definitely more than that.
Okay.
While a digital rectal exam can provide valuable information,
Yeah.
the gold standard is still a prostate biopsy.
Okay.
But before we go poking needles,
Right.
we can use imaging like MRI to visualize the prostate
Yeah.
in detail and pinpoint suspicious areas.
Uh-huh.
We're also seeing new urine biomarkers
Right.
like PCA3,
PCA3?
which can help improve the accuracy of diagnosis.
So it's about being as precise as possible.
Exactly.
Not just taking random samples.
Right.
But even with all these tools, there's still that risk of overdiagnosis, right?
Yeah.
Finding cancers that might never have caused any problems.
You bring up a good point, and that's where things get a little ethically tricky.
Yeah.
Not all prostate cancers are created equal. Some are slow-growing and might never become life-threatening.
Okay.
And overdiagnosis can lead to unnecessary anxiety
Oh, for sure.
and potentially harmful treatments
Yeah.
for something that wouldn't have caused harm in the first place.
That's a tough pill to swallow.
It is.
Yeah, the idea that treatment could actually do more harm than good.
Absolutely.
So once a biopsy is done,
Right.
how do doctors figure out how aggressive the cancer is
Right.
and what the next steps should be?
Well, that's where the Gleason score comes in.
The Gleason score.
Yeah, pathologist analyzes the biopsy under a microscope
Uh-huh.
to see how aggressive the cancer cells look.
Okay.
And this, along with the stage of the cancer, which tells us how far it is spread,
Right.
helps guide those treatment decisions.
Okay.
And interestingly, the guidelines actually point out that even a low Gleason score on a biopsy
Oh, wow.
can be misleading
Okay.
because a biopsy only samples a small portion of the prostate.
Mm-hmm.
A more aggressive area could be missed.
So it's almost like detective work.
It is.
You're piecing together all these clues to understand the full picture.
Exactly.
And you mentioned staging,
Yeah.
which I know is all about how far the cancer has spread.
Right.
How does that factor into the treatment decisions?
Well, think of it like this. The EAU guidelines use a risk group classification system
Okay.
based on PSA levels, Gleason score, and stage.
Gotcha.
They categorize prostate cancer as low,
Okay.
intermediate, or high risk.
Okay.
And this helps determine the likelihood of the cancer spreading
Right.
and guides doctors toward the most appropriate treatment options for each risk level.
So a man with low-risk cancer might be managed differently than someone with high risk.
Exactly.
That makes sense. But
Yeah.
I know it's not quite that simple.
You're right. It's not one size fits all.
All right.
Age, life expectancy, overall health.
Uh-huh.
These are all critical factors.
Yeah.
You know, an 80-year-old man with low-risk prostate cancer and other health issues might opt for active surveillance,
Active surveillance.
which means closely monitoring the cancer without immediate treatment.
Okay.
On the other hand, a younger man with high-risk cancer
Yeah.
might need more aggressive treatment, like surgery.
So active surveillance, that sounds like kind of a delicate balance between watchful waiting
It is.
and then taking action when needed.
Exactly.
What exactly does that entail?
So active surveillance is gaining popularity, especially for low-risk cases.
Okay.
It recognizes that not all prostate cancers require immediate intervention.
Right.
Instead of rushing into treatment,
Yeah.
men can choose to monitor the cancer
Uh-huh.
with regular PSA tests,
Okay.
digital rectal exams,
Yeah.
and perhaps repeat biopsies.
Gotcha.
And if there are signs of the cancer becoming more aggressive,
Right.
then treatment options can be discussed.
So it's about being proactive,
It is.
not just passively waiting for something to happen.
Exactly.
But I imagine there's a huge psychological component to that.
Absolutely.
You know, knowing you have cancer,
Right.
even if it's low risk, can't be easy.
It can be very stressful
Yeah.
living with that uncertainty.
Yeah.
That's why open communication with your doctor is paramount.
Right.
They can help you weigh the pros and cons of active surveillance
Yeah.
versus immediate treatment and address any concerns you might have.
It sounds like a lot to process,
It is.
both physically and emotionally.
Absolutely.
And this is all before we've even discussed specific treatments.
Exactly. We've laid the groundwork by discussing the risk factors,
Yeah.
diagnosis,
Uh-huh.
and the concept of active surveillance.
Right.
Now, let's dive into the treatment landscape itself,
Right.
which has seen some significant advancements in recent years.
Okay. I'm ready to hear about those advancements.
All right.
Let's get into it. Okay, so we're back, and I think the big question now is,
Yeah.
what are the treatment options?
Right.
I know you mentioned a few earlier,
Yeah,
but let's really kind of unpack each of those.
absolutely. And we've got a range of approaches,
Okay.
each with its own pros and cons. So let's start with the most well-known one,
Okay.
radical prostatectomy.
Radical prostatectomy.
Yeah,
That sounds intense.
it does sound pretty intense.
Is it as radical as it sounds?
Well, it involves surgically removing the entire prostate gland
Okay.
and some of the surrounding tissue.
Uh-huh.
It's a major surgery, no doubt about it.
Right.
But techniques have come a long way.
Okay.
We've got open surgery, laparoscopic,
Yeah.
and even robotic-assisted surgery.
Wow.
Each approach has its own benefits and drawbacks
Okay.
in terms of recovery time,
Yeah.
potential complications,
Right.
and the surgeon's experience.
So what about the big thing everyone thinks about with surgery, which is
Side effects.
side effects? Yeah.
Of course.
This is major surgery.
Yeah.
So I imagine there are some risks involved.
There are, and the two main concerns are urinary incontinence,
Okay.
meaning difficulty controlling urine flow,
Right.
and erectile dysfunction.
Yeah, that's a big one.
Yeah, those can be temporary
Okay.
or unfortunately permanent,
Right.
depending on the individual and the surgical technique.
Okay.
But the good news is that advancements like nerve-sparing surgery
Nerve-sparing surgery.
are aimed at preserving those nerves that are responsible for sexual function,
Okay.
which can significantly reduce the risk of erectile dysfunction.
So that's good that they're able to,
It's a big improvement.
yeah, work around that at least a little bit.
Yeah, definitely.
So surgery is one option.
Right.
What about radiation therapy?
So radiotherapy uses high-energy beams to kill cancer cells.
Okay.
It can be delivered externally, where a machine outside the body targets the prostate,
Right.
or internally with brachytherapy,
Brachytherapy.
where tiny radioactive seeds are implanted directly into the gland.
Directly into the gland. Okay.
Yeah.
Are the side effects similar to surgery?
There's some overlap,
Okay.
but also some key differences.
Okay.
Radiotherapy is less invasive than surgery.
Okay. Less cutting.
Right, no cutting involved.
Yeah.
But it can still cause urinary problems, bowel issues, and fatigue.
Yeah.
The specific side effects really depend on the type of radiotherapy used
Right.
and the area being treated.
Okay.
So, for example, some newer techniques like IMRT, VMAT, and SBRT.
Wow, those are a lot of acronyms.
They are.
Yeah.
But these techniques allow for more targeted radiation delivery,
Okay.
potentially minimizing damage to the surrounding healthy tissue.
So less collateral damage.
Exactly.
That's really good.
It is.
So it sounds like there are a lot of options within radiotherapy itself.
There are.
But let's shift gears a little bit to something you mentioned earlier that I'm really curious about.
Yeah.
Focal therapy.
Yeah.
It sounds almost too good to be true.
Right.
You're treating only the areas of the prostate with cancer,
Yeah.
leaving the rest of the gland intact.
That's the idea.
Is it really that good?
Well, it's a very appealing concept,
Right. Yeah.
and the potential benefits are huge,
Okay.
especially in terms of preserving quality of life.
Right.
But it is still a relatively new approach, and there's a lot of the debate in the medical community about its long-term effectiveness.
Okay. So more research is needed.
Absolutely. We need more data,
Yeah.
especially long-term follow-up studies,
Right.
to really understand how it stacks up against surgery
Yeah.
and radiotherapy.
So while promising, it's not like a slam dunk just yet.
Not quite yet.
What are the main concerns surrounding focal therapy?
One big question is whether treating only a portion of the prostate
Okay.
might miss some cancer cells
Okay.
that could potentially spread later on.
Right.
Also, the technology is still evolving, so there's a learning curve for doctors performing these procedures.
Yeah.
And then there's also the issue of cost effectiveness.
Okay. Yeah, money always comes into play.
It does, unfortunately.
Yeah.
Focal therapy can be expensive,
Okay.
and insurance coverage varies.
So it's not a decision to be made lightly.
Absolutely not.
Okay.
A lot to weigh there.
All right. Now, you also mentioned hormonal therapy.
Right.
How does that fit into the picture?
So hormonal therapy plays a critical role,
Okay.
often in conjunction with other treatments,
Okay.
like surgery or radiotherapy.
Right.
It can also be used on its own,
Okay.
especially for advanced prostate cancer.
Uh-huh.
The idea is to lower the levels of male hormones,
Okay.
or androgens,
Androgens.
which can fuel the growth of prostate cancer cells.
So you're basically trying to starve the cancer.
Exactly,
Those-
of what it needs to grow.
Yeah.
Yeah,
But are there downsides to kind of messing with the hormones like that?
there can be.
Okay.
Hormonal therapy can cause hot flashes,
Uh-huh.
fatigue, loss of libido,
Okay.
even erectile dysfunction,
Yeah.
not to mention potential effects on bone health
Right.
and cardiovascular health.
Wow. So a lot of potential side effects.
There are.
Yeah.
There's also research exploring a potential link to cognitive decline.
Really?
So it's a complex treatment
Yeah.
with benefits and risks that need to be carefully considered.
It sounds like quality of life is a major factor
It is a huge factor.
in deciding whether hormonal therapy is the right approach.
Absolutely.
And this kind of brings up a point that we touched on earlier, which is
Yeah.
what happens when the cancer comes back,
Right.
despite the initial treatment?
That's where the concept of biochemical recurrence, or BCR, comes in.
BCR?
Yeah. It's defined as a rising PSA level after treatment,
Okay.
indicating that some cancer cells might still be present in the body.
Gotcha. So it's not gone.
Right.
But
it's
yeah.
kind of lurking.
Yeah.
Now, the good news is that a rising PSA doesn't always mean the cancer is back with a vengeance.
Okay, that's good.
The EAU guidelines actually have a new risk classification system for BCR.
Okay.
That takes into account how quickly the PSA is rising.
Right.
And other factors to determine the appropriate course of action.
So it's not just a matter of hitting the panic button
No.
at the first sign of a rising PSA.
Exactly.
It's about understanding the context
Right.
and the individual's risk level. So what are the options then for treating biochemical recurrence?
It depends on a lot of different factors,
Okay.
like the initial treatment received,
Mm-hmm.
the risk group, and the man's overall health.
Okay.
Salvage therapies,
Salvage therapies.
things like salvage radiotherapy or surgery
Right.
might be considered.
Okay.
Advanced hormonal therapies are also often used,
Uh-huh.
and in some cases, chemotherapy might be recommended.
So even if the initial treatment doesn't completely get rid of the cancer,
Right.
there are still options on the table.
There are.
But beyond the specific treatments, what about the bigger picture
Yeah.
of living with prostate cancer?
Right.
It's a diagnosis that can impact so many aspects
Absolutely.
of a man's life.
You're absolutely right. The emotional and psychological toll can be immense.
Right.
Anxiety, fear, uncertainty.
Yeah,
These are all natural reactions to a prostate cancer diagnosis.
for sure.
And then there are the potential long-term effects of treatment
Yeah.
on urinary, sexual, and bowel function.
It's a lot to cope with.
It is.
So how can men and their families kind of navigate this challenging terrain?
Yeah.
What kind of support is available?
Well, support groups can be incredibly valuable.
Support groups?
Yeah. They provide a space to connect with others
Right.
who truly understand what you're going through.
Right. It's not the same as talking to someone who
Yeah.
hasn't been through it.
Right.
Yeah.
Counseling can also be helpful
Okay.
in providing guidance and coping strategies.
Yeah.
And, of course, the support of family and friends is crucial.
Yeah, for sure.
Having a strong support system can make all the difference.
It sounds like a team effort is needed
It is.
from both healthcare professionals and loved ones.
Absolutely.
But before we delve deeper into the emotional and psychological aspects,
Okay.
let's take a moment to highlight some of the most intriguing details from the EAU guidelines
Okay.
that maybe aren't common knowledge.
Yeah, that's a great idea.
Yeah.
There are definitely some hidden gems in these guidelines that deserve a closer look.
Okay, let's do it. Okay, so we are back and ready to uncover some of those lesser known but equally important details from the EAU guidelines.
Right.
I know when I was reading through this stuff, I was really fascinated by the discussion of new urine biomarkers.
Oh, yeah.
Like PCA3.
Right. PCA3.
It seems like those could really change the game
Yeah.
in terms of early detection and risk assessment.
Absolutely. So PCA3 is a gene
Okay.
that's overexpressed in prostate cancer cells,
Okay.
and we can detect it in urine samples.
Right.
And what's really interesting is that PCA3 seems to be more specific to cancer than PSA.
Oh, wow. So that's huge.
It is a big deal,
Yeah.
meaning it's less likely to be elevated by benign conditions.
So it could potentially really cut down on
It could.
those unnecessary biopsies.
Absolutely. It could help us identify men
Yeah.
who truly need further investigation
Right.
and potentially spare others from those unnecessary biopsies.
That would be a huge step forward. I also found the increasing use of MRI in prostate cancer diagnosis and treatment really fascinating.
Oh, yeah. MRI has become an indispensable tool.
It really has. It feels like we're moving from like blurry black and white pictures
Right.
to like high definition full color views of the prostate.
Exactly. We can visualize the prostate gland in incredible detail,
Yeah.
identifying suspicious areas
Right.
that might warrant a biopsy.
Mm-hmm.
It's also invaluable for guiding treatment,
Okay.
ensuring that radiation or other therapies are precisely targeted.
Okay. So less damage overall.
Exactly, minimizing damage to surrounding healthy tissue.
And I know that's a big concern for a lot of men.
It is.
With any of these treatments.
For sure.
Is, how much damage is this going to cause?
Right.
So being able to minimize that with these new technologies.
The level of precision we can achieve now is remarkable.
It really is. It's amazing how technology is transforming healthcare.
Absolutely.
I mean, in every aspect, it's amazing.
It is.
Another point that really stuck with me was the discussion of the psychological aspects of active surveillance.
Oh, yeah. For
Now,
sure.
It's one thing to understand the logic of it,
Right.
but it's another thing entirely to live with that knowledge that you have cancer,
Right.
even if it's low risk.
Absolutely. It's a huge emotional burden.
Yeah.
Anxiety and fear are natural responses.
Yeah, for sure.
And it's crucial for doctors to address these concerns head on.
Right.
Active surveillance is not about ignoring the cancer.
Right.
It's about managing it proactively
Yeah.
with close monitoring and open communication with your healthcare team.
It's not just a set it and forget it type of thing.
No, not at all.
Yeah.
Building trust and understanding is essential for making this approach work.
Yeah, and it really speaks to the importance of having a doctor that you trust.
Absolutely.
And who you feel comfortable talking to.
Right. You need to have that open line of communication.
Absolutely. And this kind of brings up another concept that we've talked about a little bit, which is shared decision-making. Right.
Shared decision-making.
You've emphasized that a lot in this conversation.
Yeah.
Why is it so crucial in the context of prostate cancer?
Well, because there's rarely a single right answer when it comes to prostate cancer treatment.
Right. It's not a one-size-fits-all.
Exactly. Each man's situation is unique.
Right.
And the best approach really depends on a multitude of factors.
Okay.
Risk level, age, overall health, personal values, even lifestyle preferences.
Yeah.
Shared decision-making means that the man in consultation with his doctor makes an informed choice
Okay.
that aligns with his individual needs and goals.
So it's not just about what the science says.
Right.
It's about what matters most
Exactly.
to that individual.
To that individual man.
Yeah.
Absolutely.
And I think this deep dive has hopefully given our listeners the knowledge they need
I hope so.
to have those informed conversations with their healthcare providers.
Yeah, we've covered a lot of ground today.
We have.
From the basics of prostate cancer to the latest advances in diagnosis and treatment.
Right.
But I think the most important message is this. You are not alone.
That's so important.
Prostate cancer is a common disease.
Yeah.
And there are millions of men around the world facing similar challenges.
Right.
Don't be afraid to reach out for support,
Absolutely.
whether it's from loved ones, support groups, or healthcare professionals.
There are resources available,
There are.
treatments available, and most importantly, hope available.
Absolutely.
And I think that's a really powerful message to end on.
I think so too.
This has been an incredibly informative deep dive
It has been.
into the world of prostate cancer.
Yeah.
I know I've learned a lot, and I hope our listeners have too.
Me too.
So before we sign off,
Okay.
is there one final piece of advice that you would like to leave our listeners with?
I would say if you are concerned about prostate cancer, don't wait.
Don't wait.
Talk to your doctor.
Yeah.
Early detection is key.
Absolutely.
And the sooner you have the information you need, the better equipped you'll be to make the best decisions for your health.
Well said. Thank you so much for joining us today on the deep dive.
It's been my pleasure.
And to our listeners, we'll be back soon with another deep dive into a fascinating topic.
Looking forward to it.
Until then, stay curious, stay informed, and stay healthy.
And remember, knowledge is power.
Knowledge is power.
The more you know, the more control you have over your health journey.
Absolutely. All right, everyone, thanks for tuning in, and we'll see you next time.